Hi everyone, welcome to this lecture on what is GIS. My name is Chris Willer and I'm a PhD candidate in the Department of Geography at Kent State. In this lecture you're going to get an overview of GIS. We'll talk about some of the main components of GIS and why it matters. In addition, we'll get into the types of data used in GIS as well as show how GIS is used in health research. To give you some of my background, I've used GIS in various research projects while at Kent State, including work on asbestos exposure and demolition in the city of Buffalo, as well as work on geographical disparities of obese pregnant women in Summit County, Ohio. In addition, I have also used GIS while I worked in the private sector at Signet Jewelers in Fairlawn, Ohio. There I used GIS to examine jewelry store market areas. So the objectives of this lecture are to 1. Describe GIS as a research and data analysis technique, to explain what spatial data is in relation to healthcare, to describe scale and explain its importance for developing interventions. Now, when I say interventions, which I'll be bringing up throughout the lecture, interventions are just acts performed for a person or population with the purpose of assessing, improving, maintaining, promoting, modifying health or health conditions in a particular area. Okay, and then lastly, uh, we'll be discussing common uses of GIS in health-related research. So there's 6 parts to a geographic information system, including people, software, data, procedures, hardware, and then obviously the network that binds these 5 components together. In terms of people, these are individuals that are actively using GIS to analyze data. It can also include individuals that are part of the data collection process, where you can extract spatial information from the data and incorporate it into a GIS. Software, on the other hand, is just the application that you use to analyze your spatial data. These can include the industry standards ESRI's ArcGIS. It could include Google Earth. It could include QGIS, which is an open source software, or you can even include your Google Maps application on your phone. That is a very simple form of a GIS that I'm sure all of you are familiar with. Okay, in terms of data, data is just that spatial information that we're extracting. Okay, this could include a street address from a patient. It could include the zip code of where a patient lives, the city, the state, the county, etc. Right? And then we can incorporate that into our software and analyze it when we have, say 1,000 patients, for instance, that might be exhibiting a high fever or flu-like symptoms, for example. Okay. Now procedures are just the steps that we take within a GIS to analyze the data. It can also include the steps we take to collect data. Okay, there's a variety of ways um, in which geographers can collect spatial data, and I'm not going to get into all of that right now. I'll talk about some ways later on in the lecture, but in your case as healthcare practitioners, the creation of electronic medical records, and when you're talking with your patients and recording that data, that is a very specific set of procedures that you take to have data collection in an organized fashion. Okay. Next is our hardware. This is just your desktop computer, your laptop, and then obviously the network again, which just ties everything together. Now, getting more into the more specifics of kind of the thinking behind a GIS, specifically the software of a GIS. We want to conceptualize a GIS as just a layering of maps. Okay, so if we're looking at the image on the right hand of your screen, we can see three maps. One showing street data, which is just a road network, say of Portage County. The next is building data, which could be property parcels, it could be outlines of homes or whatnot. Um, the third is vegetation data, right? So this could be park space, it could be open fields, it could be forests, woods, etc. Right? And then obviously when we layer those on top of one another and put it all together, we have an integrated data um, uh, map, right? Which we see on the bottom of that layer. Okay, and this is just a way that geographers try to model the real world. Obviously, models lose some detail in the process, no differently than a model car or a model home, right? Obviously, they don't have as much detail as the real thing, but they do give us a good picture of what reality or the real world is like. Okay, again, a GIS is just a computerized tool for solving geographic problems. Okay, and this tool allows us to reveal certain patterns and processes in geographic form. Okay, so getting into more of the wide range of things that can be underneath the umbrella of GIS, right? There's a variety of jobs and positions that can operate under the title of GIS, and I'll briefly go through those. So starting off with um, the red um, bubble, analyze, right? This section of GIS is typically those that are doing some form of statistical and spatial analysis, right? That maybe they're looking for a hot spot of coronavirus cases or a clustering of coronavirus cases, right? And they're trying to statistically and spatially analyze how that came about temporally or again spatially, right? Our next section, the building bubble, right? This is just more more suited for programmers and those who build applications. Okay, so obviously, when you have a smartphone, an iPhone, or whatever, there's a lot of programming that goes on behind the scenes to build the applications that you use. So for instance, when we're using our Google Maps on our phone, say we're trying to get from our home to the nearest hospital, um, we have programmers that extract the geographic location from where we are in space from our phone and then collect all the spatial data on where the nearest hospital is. Okay, and then it'll give you the best um, route within a street network and the fastest route to get to where you need to be, right? So that is kind of the application, the development and building of a GIS, kind of the behind the scenes work that um, you and I might not necessarily see in our day to day. The third bubble that encompasses GIS is the visualization component, right? So obviously, this is dealing with cartography and geovisualization. So trying to communicate sometimes complex information to the broader public or higher ups that are involved in decision making, right? So kind of hey, say you're working at a hospital, and over the past week there's been a high rate of coronavirus cases coming into the emergency room, and you say you're taking out the street address or the zip codes of those patients, and you're trying to analyze if there's some kind of clustering or process going on, you can report that and try to communicate that visually to a director or someone who's involved in broader decision-making processes, maybe with a county board of health or the health department or whatnot. And then lastly, we have create. Okay, create is just data administration and management, right? So this again is an extremely important component of GIS in that if your data is bad, your analysis is going to be bad, right? So it's so important that we have, getting back to our previous slide on procedures, it's so important that procedures are standardized across the board. Okay. For example, think of the U.S. Census, right? The U.S. Census has a very, very strict methodology in how they collect data from the United States' population, right? they can't, New York or Ohio can't deviate from that procedure, or it screws up how the data is utilized, okay, and it's not clear cut across the board. So again, data administration and management is extremely important when we're dealing with GIS. Okay, so hopefully by now I've kind of hinted at why the importance of GIS, but again, coming from a geography background, the key point here is that almost everything happens somewhere. Okay, it can happen very proximate to you, or it can happen very far away, but it still has some kind of effect on you as an individual, right? And really knowing where some things happen is critically important, right? So again, I kind of talked about say you were a physician at a hospital or an EMT, it's really important to know the location of emergency rooms, for example, and trying to get from a 911 call as fast as you can to the hospital to save someone's life, so to speak. That's in a very simple sense, that might be a good example. Or if you're interested in food deserts, okay, knowing where the location of a grocery stores or fast food chains within a metropolitan area can provide a lot of insight into uh, community health overall and community access to healthy foods, right? Access to parks, okay, is another good example. And then lastly, and I would say most pertinently right now, thinking about where cases in context of COVID-19 are located, right? There's a lot of information that we can extract from knowing those types of locations and creating interventions to aid in slowing the spread of coronavirus. Okay, so now we're going to be getting into types of data that geographers use within a GIS. Okay, so specifically we call these types of data spatial data. Okay, so again, as I talked about on the previous slide, spatial data has some form of uh, spatial attachment to it, whether it's a latitude or longitude coordinate, a an area such as a zip code, right, which is just a collection of points that are connected by a line, and those points had coordinates to them. Um, but really, before I get into the weeds on this, there's two types of spatial data that we use. Okay, one is raster and the other is vector. Now, raster data is just a matrix of pixels, right? No differently than the matrix of pixels on your computer screen or on your television, right? Obviously, the smaller the cell of the pixel, the finer the resolution that you would get, right? So if you go back to 1990, certain television sets were very pixelated. They had very large cells, and now we're getting into screens that are much more finer, so the smaller cells, okay, that provide a certain clarity of things, right? So rasters are, again, they're just, think of it as a matrix of cells, okay, and each cell represents a type, has a value in it of data, okay? So if we were trying to map out hotels with a raster, um, all the cells that have hotels might be coded as a 1, and those that don't have it are coded as a 0. So the cells with the hotels will be coming up black. No differently than if we were looking at lines for ski lifts or rivers, right? So the cells that go over the ski lift or go over the river obviously will be coded differently than those that don't. Same thing with a forest, a road network, or elevation. Okay? Now, for health data, geographers typically use vector data. Okay? Not, sometimes they incorporate raster data, which typically comes from satellites or aerial imagery from the Earth. Um, Healthcare data is typically utilized in vector format. Okay, now vectors have three subtypes of data, including points, lines, and areas. Okay, um, so points, again, say we're trying to map out hotels or hospitals. We're literally taking the the latitude, longitude coordinate of those locations and plotting it, no differently than if we were plotting points on a map. Okay. Same thing with lines, right? Say we're trying to do a street network. Obviously, lines are just an array of points that are connected by a line. Okay, so any turn or intersection will be represented by a point, and between those points is just a line that um, can actually represent the road. Areas, okay, whether that be a zip code, a county, a city, right, things like that, uh, are a closed system of an array of points, right, by lines. Okay. So, trying to give you an example of some raster data when examining coronavirus. This is coming from a news article that I found a few months ago, looking at nitrogen oxides in the atmosphere, and obviously we can see, comparing the first 2 months of 2019 to the first 2 months of 2020 over Wuhan, China, we can see a huge drop in nitrogen oxides in the troposphere above this part of China, right? Nitrogen oxides are typically byproducts of human activity such as industry, and clearly we can see the impact that the closing of Wuhan and the isolation and quarantining of individuals in that area of China did to slow industrial production in that part of China, right? And we can readily see the changes from 2019 to 2020. Okay. So again, moving forward into vector data, obviously we have polygons, points, and lines. Okay. Um, in terms of health data, polygons are an extremely common health GIS output. Okay. For one, it helps preserve confidentiality. For example, you might have, say there's 1,000 cases of coronavirus patients in Portage County. You're not going to map um, uh, their their street addresses or the points where they actually live, because that's a HIPAA violation. So what you do is you take all their locations and you might count how many cases there are within the zip codes of Portage County, and then that helps preserve confidentiality and kind of hides the location of those coronavirus patients. Okay. In addition, there's easily available secondary data. Okay, this could be coming from the census, such as population statistics, um, things on demographics, such as race, income, socioeconomic status, information that might be pertinent when we're examining uh, health. Okay. At the same time, there is an issue with polygons, is that depending upon the size of the polygon or the scale that we're looking at, it can be too coarse for intervention, right? So, um, looking at Portage County as a whole might not necessarily allow for a very focused effort in intervening on coronavirus. It might be easier to intervene at a zip code level or a census block level, which is much more finer and closer to the ground. Okay. Um, this map that I have is a good example of polygon health data, right? So specifically, we're looking at how the virus spread in China from January 21st to February 11th, right? And we can see the darker the red, the more cases. And this is just a very, very easy way to visualize and communicate data in terms of how the virus spread throughout China. Okay. So the next type of data I want to talk about is point data. Okay. So again, an example of point data could be an address, right? So 123 Main Street, Kent, Ohio, right? You can just put a point right over that home, um, And the good thing about this type of data is that it's commonly recorded on electronic medical records, right? So in addition to a street address, there's also the zip code, a city, and a state. And this can easily be, again, as I talked about on the previous slide in terms of, or the 2 slides ago, in terms of polygon data, this can easily be aggregated into polygons. Okay, you can start out with point data and then aggregate it into a different form of data. If that makes sense. Point data is really good. Um, because it allows for a fine scale resolution for intervention. Um, it works well if you're not necessarily reporting to the broader public. Like, say, for example, at a particular primary care facility, if you have, maybe 20 coronavirus cases, you can look at where those patients are located, and uh, you don't necessarily have to report that and get in trouble with HIPAA violations, right? So if you did report that and you reported locations of coronavirus cases, obviously that would be a big issue. But it does, again, it does allow for more fine scale intervention, right? Very focused efforts in assessing, improving, maintaining, promoting, and modifying um, health for your patients. Okay. The last type of data is line data. Um, I was trying to think of some ways in which this would be applicable to uh, your type of work. Um, Obviously, line data when we're dealing with health research is more deals with the issue of access. So access to healthcare facilities, access to healthy foods, right? Access to facilities that sell healthy foods, things like that, right? Um, so obviously, line data can include street networks, trails, bike paths, sidewalks. Um, so the table on the left is just a table of uh, the top 15 cities in the U.S. Um, between 2008 and 2012 that have the highest rates of walking to work, right? So this is kind of a good way to assess, um, you know, how active a community might be, and more, maybe more, how much time they do or don't spend in cars and commuting, right? So, for example, Athens, Ohio ranked number 2. Obviously, Athens is a little more secluded, um, and it is a college town, but again, it's a good way to think about how active a community is, right? So on the map on the right, I mapped out all the roads around Athens, Ohio, and then I also mapped out all the sidewalks within the city to kind of visualize the access to the core of Athens, right? So obviously there's a lot of places within this area that would need to get to Athens by car, but for the most part, it's a very, very densely populated area where most people do have access to, um, say, Ohio University for work. Okay. Now, let's think of an example. Um, Say you were interested in seniors 65 plus and their access to nursing home facilities in Ohio. There's a variety of ways that we can look at this in a GIS, right? So starting off, we might map out um, seniors by county, right? So what's the percentage of individuals over 65 and over in each county in Ohio, right? So this is just a snapshot of a GIS called QGIS, right? And what we do here is we bring in spatial data called Ohio counties, okay? And within this data, we have a matrix, right? So the matrix for each row, right? So row 1 might be Portage County or Summit County. So each row represents a county in Ohio. And then each column is a particular data, okay? So it could be a raw count of the number of mobile homes in the county. It could be a raw count of the average size of a farm in a county. Here we're going to be dealing with senior PCT, which is just the percentage of seniors in that county, okay? So next, we can take that percentage and create a choropleth map, okay? So in this map that I've created, we have the darker colors, the darker purples or magentas representing higher percentages of seniors within a county, okay? And then the lighter the color represents counties with a lower percentage of seniors, okay? So clearly we can see parts of eastern Ohio having higher counts of seniors, okay, compared to areas around Columbus, okay, central Ohio, right? So that's kind of like the first takeaway if we're looking at this visually, okay? And then getting into uh, facilities, right? We can bring in some facility locations data, right? So Ohio 2017 health facility locations by SIC code. Now, a SIC code is just an industrial identifier, so it identifies what type of industry a business or a company is in, right? So I took business locations from 2017 that have a SIC code that starts with 80. Now, 80 if the first two digits of a SIC code are 880, that represents it's in the healthcare industry, right? And then we can individually look at what types of healthcare, whether it's an optometrist, a dental clinic, hearing aid business, things like that, right? So these are, I mean, obviously they're very, very tiny dots, but these are all the healthcare businesses in Ohio, and we can see how they're located. Obviously, we have huge clusters around Columbus, okay? We have huge smaller clusters in counties. I'm assuming these are the county seats or the most populated small cities in each county. We have obviously clustering around Cincinnati, Dayton, Toledo, Cuyahoga, Akron, Canton, and then Warren, Youngstown, right? So it makes sense. Where we have a lot of people, there's a lot more access to healthcare facilities than in other parts of the state. Now, again, so the other thing that we want to think about is we're looking at seniors, and we're trying to identify areas where there might be cold spots per se. Right now, this is not statistical in any way, fashion, but we can see parts of this county, or excuse me, these three counties, have a relatively low amount of healthcare facilities in them. You know, it looks kind of sparse visually speaking. Okay, so thinking about the types of things that seniors might need access to, I selected based on their description, right? I selected all the types of services that seniors might need, such as skilled nurses or home nurses, things like that, and map those. And what we can see here is these are, again, a subset of that broader data set, and we can see the kinds of patterns that exist across Ohio on a broader scale. Now, again, getting back to the issues of coarse versus fine scale, this is a very, very coarse picture of senior citizens in Ohio and healthcare facilities that seniors typically use, like nursing homes, home care, things like that. So intervention can be potentially difficult if we're looking at this type of scale. Okay. So getting into scale, um, scale is uh, either fine or coarse. Okay, it's either large scale or small scale. And think of scale as how zoomed in to the map are you? Okay, are you zoomed in so you can see the whole picture of Ohio, or are you zoomed into Portage County? Okay, or are you zoomed in even further and looking at the city of Ravenna or city of Kent, right? So scale, depending upon how zoomed in you are, can either give you more detail or less detail, right? And this can create some difficulties when we're thinking about interventions. Okay, so let's take this for an example, right? So this is from Johns Hopkins University. Okay, this is their kind of the overall trends of coronavirus cases in the U.S. And a couple takeaways here. So obviously this is visually appealing. It's fairly easy to read. We can see the reds are the states, um, and the pinks and the reds are having a an upwards trajectory in terms of cases, whereas the darker the green blues are having a downward trajectory, right? Um, Personally, it's a good visual, but it doesn't really say that much um, for me, right? So number one, New York is down significantly, but it's not giving any standard or standardization to compare New York's rate with that of Ohio. Does that make sense, right? It's not saying, oh, New York's at 1,000 cases per day, whereas Ohio's at 1,200 cases per day. So it doesn't really allow for any standardization to compare across states. It's just giving a general trend within each state. Okay. And again, this is a very coarse scale, right? We're kind of zoomed out from a map and we're looking at the U.S. from above, much further away. Okay. Now let's zoom in a little further. Okay. So again, this is a map of the rate of cases in Ohio. Okay. So it's finer. We're a little zoomed in. We can see the counties of the state of Ohio, but it's still relatively coarse, and it's not really giving us um, uh, a good snapshot on how we can intervene per se. Obviously, the state has done a variety of different um, policies and has taken action to affect some change, but again, it's still relatively coarse. Okay, especially for individuals like you as primary care physicians, it's too coarse for you to really um, um, help out, so to speak. Okay. Now, I think this is a better picture of what you all might be dealing with. So this is relatively a fine scale of confirmed COVID-19 cases between Summit County and Portage County, and this is by zip code. Okay. So the darker the blues represent the higher um, uh, confirmed COVID-19 cases across these two counties, right? So this is a good way to think about if you're, Portage County Health Department or Summit County Health Department, and thinking about where can we intervene, what types of things can we do um, uh, to affect change. Okay. Okay. So moving forward, thinking about GIS and health and how mapping and GIS are applied to health research, right? So this really started out in 1854 with John Snow. John Snow uh, was an epidemiologist that studied the cholera epidemic in London. Okay, and He's very, very famous for identifying this water pump on Broad Street in London as the point source for the cholera epidemic. We can see a clustering of these bars near the pump, right? So a very relatively confined area. Kind of draw around where these bars end. A relatively confined area of where people were living and who was using that pump compared to outside, right? So there's other pumps on the outside of this that did not have the disease, right? So individuals that frequented this water pump were at greater risk for getting cholera, right? So this is kind of like the first type of a GIS, that kind of spatial analysis and identifying, again, patterns and potentially processes of health-related issues. Okay, and spatial analysis, like what John Snow did with the cholera epidemic in London, is a very, very informative technique. Okay, there's a lot that a map can show you, right? So if we're looking at this map right here, we can see in October 2020 the density of observed smokers on Kent State's campus. Okay, so obviously there's higher smoker occurrence shown in the darker shades of red. So this is around the student center and outside the library, right? So there's higher, we can see where this clustering occurs, okay? And the other smaller clusters are outside of main academic buildings, okay? So popular spots with a lot of traffic, right? So we can see the patterns in which where students might be exposed to secondhand smoke, okay? So that's one example. Another example, if we're looking here, we're looking at, so in the color, we're looking at all the residential housing parcels in the city of Akron, okay? And we're mapping those by year their homes were built. Okay, so the oranges represent homes built before 1950. The greens are post 1978, and then the yellows are between those two time periods. Okay, the contours, right? We can see this here. These contours represent gradients for individuals that had high blood lead concentrations in the city of Akron. Okay, so we're taking point data and we're turning that into a density. Okay, so areas where we have very, very tight lines represents where there's a lot of cases of patients with elevated blood lead levels. Okay, so this relates to housing data because I believe pre-1978, homes utilized lead paint, right? So exposure, thinking about environmental exposure among patients, thinking about the geography of where your patients live has a huge impact on their health, okay? So here's another data, some work that I did on obese pregnancies in Summit County. Okay, so this is looking at your map on the left, map 1. We're looking at locations of large grocery stores, fast food restaurants, the city of Akron's boundary, and then the standard deviation of women between the age of 15 and 45 who were a percentage of women age 15 to 45 who were obese and pregnant, or who had a pre-pregnancy BMI of greater than 30. Okay. the second map in the center is just showing a global representation of hotspots of obese pregnancies, right? So women who were obese prior to their pregnancy, right? And we can see clusters or hotspots emerge in this red. And we can see the emergence of cold spots in the dark blue, right? So obviously, the more wealthier suburbs of Summit County, right? So you have, I believe, Hudson's up here. You have, I believe this is Twinsburg, and this is, I think, Solon. You have cold spots, right? And then women closer to the core of Akron, we see more hot spots, okay? Now the third map is just showing the statistical significance of each individual block group. Okay, so block groups have anywhere from 600 to, I believe, 3,000 people. And this is, again, this map is showing, is the value statistically significant within each individual block group, right? So looking at this block group, that's a darker green, that is very, very significant, okay? Compared to a lighter green. But nonetheless, these are all significant over 0.05, a p-value of over 0.05. So this kind of spatial analysis can inform you as primary care physicians in terms of where interventions need to take place. Okay, obviously we have hotspots on the west and south side of Akron. We have hotspots in Cuyahoga Falls right here. Okay, West Akron. So those are some areas that might need some intervening to aid this type of issue from a policy perspective, from a healthcare perspective. Okay. Another piece of work that I've done is looking at asbestos exposure in relation to demolitions of homes in the city of Buffalo. Okay. We can see, so the downtown, if you've never been to Buffalo, here's the downtown core, and then anything, this is, I believe, Main Street. Anything east of Main Street is a very, very hyper-segregated part of the city, and we see that there's a lot more homes that have applied for asbestos removal compared to other parts of the city. So these points are representing houses that applied for a building permit to get asbestos removed, and then we can also create a kernel density that maps out the hot spots of those homes that had asbestos exposure. Okay, so this work that I did, I also incorporated the use of geospatial video. Okay, so geospatial video, it's just basically what I did was I attached GoPros or contour video cameras to a car, and I drove through a hot spot on the map, okay, that I found. Okay, so I drove along this line, this route, okay, and I collected visual data using the video to look at, is this home vacant? Does it look vacant? Is it boarded up? Does it look like there's peeling paint? Is there exposed roofing? Is there exposed trash, right? So say they removed asbestos and there was trash lying out on the street. Is that asbestos dust being picked up? Things like that, right? And then from there, I can create these points. So these points, things like that, I can create a risk assessment on where potential asbestos exposure might occur and select all the property parcels that are within that hotspot. And that is a very, 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 very fine scale in which we can intervene. So maybe it'd be helpful for the city's health department to send notices to homes that are in this red-pink area to let them know, hey, your home might have asbestos exposure, we'd like you to get tested or things like that, and potentially try to figure out a way to remove asbestos from your home. So lastly, I'd like to get into talking about COVID and contact tracing because there's a huge opportunity for GIS to be used in addressing um, questions of who, what, where, and when. Okay, so who who is a case of coronavirus, who is a potential contact, um, what are the symptoms of these cases, okay, where are they located, and when did these occur. These are all questions that can be answered in a GIS, and are very much applicable to the public health um, issue at hand going on right now. Okay. Now, in thinking about contact tracing, it's closely aligned to this concept in geography and GIS called activity space, right? Activity space is just the average um, day-to-day area or path that you take um, in, say, your average week, average month, right? And this can certainly help out in understanding the spatial processes that groups of people might take over a period of time, right? So in the case of coronavirus, really we're thinking about, okay, where's your home? Um, where have you been? Where do you typically go in your day-to-day? Thinking about where exposure may have occurred, or where an individual with coronavirus may have um, spread the virus, right? So activity space is very much a sister concept to the things that contact tracers are interested in. Lastly, a key point in thinking about coronavirus and GIS and health is this issue called modifiable aerial unit problem. Okay, so or MOP. Okay, a MOP is just a source for statistical bias, and it can impact the results of statistical tests. Right. So if we're thinking about um, this initial square. Okay, we might have three address points for individuals, um, uh, two of which don't have corona, one might have corona. Okay, so we have region set A and then region set B, right? And these lines indicate certain aerial units that have been created by people. Okay, now this MOP issue occurs when we use point-based measures of a particular illness or disease and how they're aggregated into aerial units, right? So in region set A, we might be using zip codes, but in region set B, we might be analyzing the same phenomena using census tracts or school districts. And the MOP issue really results in data aggregation and how the map maker chooses what aerial units to use. So if we're using zip codes, we might have an illness rate of 50% in this aerial unit, whereas if we use census tracts, there might be an illness rate of 100% in a different part, in a different aerial unit. Okay, so obviously this creates issues when we're mapping rates of coronavirus um, among the population, whether that be by county, zip code, census tract, and whatnot, right? So this is when you're looking at maps of coronavirus or maps of a particular disease, always pay attention to the aerial units that are being used and the types of issues that can occur when we're looking at maps of zip codes with rates of coronavirus versus maps of census tracts with coronavirus versus maps of counties with coronavirus, right? So there's obviously a huge difference when we're comparing and contrasting uh, uh, maps that are using different aerial units. Okay. So again, just to briefly talk about some of the software, GIS software that a lot of people use. Again, I mentioned this earlier in the lecture. Obviously, ESRA's ArcGIS. This is the industry leader. Google Earth, free to download from Google Earth's website. Okay, and then QGIS is an open source software that is uh, increasing in popularity. Um, for me, I use all three. Really depends on what I'm interested in doing. They all have very similar features, especially ArcGIS and QGIS. But again, they're all very, very good softwares and relatively easy to use if you access some online resources on YouTube or their websites. Okay. So lastly, just to summarize what we've talked about on what is GIS. Again, GIS is a layering of maps. Okay. Specifically looking at spatial data. Okay. Spatial data, typically when we're looking at health and health research, we're dealing with points, lines, and polygons. Points can represent patient homes, healthcare facility locations, healthy food stores. Lines can represent street networks, trails, daily paths. Um, and then polygons can represent service areas for hospitals, zip codes, census tracts, counties, and so on. Okay. GIS is also a research and data analysis technique that can inform decision makers with spatial analysis, statistical analysis, and even with geovisualization, right? A map can say 1,001 words, right? So just creating a map of a particular health issue can say a lot and inform people. And then lastly, GIS can aid in intervention development for areas, especially when we're dealing with health research and policy, speaking on coronavirus in particular. I have a few additional resources. Okay, so these are some of the full articles that I cited. This is a really, really good book to access GIS and public health. Um, and then obviously this is a really good URL link to how ESRI and the ESRI community is using GIS to aid in contact tracing.
Thank you so much, Chris, for sharing your expertise related to GIS research and showing us how this can be applied to primary care, public health, and other types of research. If you're interested in receiving CME credit for this session, please respond to the following reflection questions on the next slide and email me your response. So, what I'd like you to think about is based on the presentation that you listened to, consider the patients or your students in your practice. What health topic would you be interested in examining from a geographical perspective and why? And then also, based on what was discussed during the presentation, what type or scale of data would you collect or map and why? And there's no wrong answers, just looking to see what some of your ideas are. Finally, for CME credit for the session, once again, please email your response to the reflection questions to me. As always, send your comments or questions to me. I really do enjoy getting your feedback. And then I'm hoping for October to have a presentation on qualitative research. And then again, thank you so much to Chris Willer for this presentation on GIS. Personally, I learned a lot from it, and thank you all for joining us for this virtual session. Please be well.